Hello guys, so if you saw the review I posted, um, the last post I made, you can go back and check it. Okay, so if you read the caption, you will see where I mentioned that there were some clients who did not respond to it, and it's actually a very interesting case, and I will tell you why. Okay, so here is a case study of 3 people. One responded to rauwolfia vomitoria, the other 2 did not. I mean, they did not get the reaction that they were supposed to get. The first case was a case of a client of mine. This was about a year or 2 ago, who is a medical doctor, and she had been battling with insomnia for years, and she had used a lot of drugs and all that, so she wanted to switch from drugs to herbs that will help her sleep. And you see, when you are moving from something stronger to something milder, you will expect that you may not see much of a result. So what happened with her was that when I recommended the dose she was supposed to take, which is a very tiny amount, she wasn't falling asleep. So she complained. I allowed her to increase it up to the limit, and I told her to stop. And she went ahead and increased it further, and then she started having the side effects that is very common with rauwolfia root, which is nausea. So she had to stop. So that time she bought 2 packs of the rauwolfia root tea, and she had opened one. So she had to beg me, please, that this is not working for her. Can she return the unopened one? And I refunded her. Yes, I agreed to that. So I did that. The second case is the case of a lady who wanted something to induce vomiting. So she asked me, do you have something for inducing vomiting? And I said yes, which is rauwolfia if you take it at a certain dose. So my assumption was that she wanted to use it maybe for poisoning, a case of poisoning. You know, when somebody has been poisoned, the person can induce vomiting to bring out the poison out of the stomach and reduce its effects. Yes, there are cases where this is done, but she didn't open up to me why she wanted that. But I just assumed anyway, because I asked, and she said, oh, she just needs it, there's no underlying issue. So I sold it to her, and then she uses it and she did not vomit. So she tells me, and I start probing, what exactly is the reason why you wanted to vomit? And that was when she opened up that she had used Ozempic, which is a drug that is being abused as a weight loss drug to lose weight. And the side effect of Ozempic is vomiting. So when you use Ozempic, you basically throw up, and once you throw up all the food you've eaten for that day, you don't feel hungry again. That's how it helps a lot of people to lose weight. So she wanted to replicate that effect with the herbs, and I told her, look, if you had told me this, that you wanted to use it to lose weight, I would have recommended a safe weight loss herb, but you didn't tell me. Anyway, so as I asked further questions, I said, what's the problem? Why do you want to lose weight? So she now had to open up to me that she had a traumatic experience, and she was given antidepressants, which makes people put on weight. So she had gotten the Ozempic to lose weight, and it indeed helped her lose weight, but she now wanted not to be too reliant on it. So she wanted a herbal a herb that can induce vomiting just like it does, so as to continue losing weight. So these 2 cases are very similar. It's just that you might not realize. Case 1 was the case of the lady who had overloaded her sleep receptors with something more powerful. used the herb, which is milder, no effect. But the receptors that are used, or rather that are responsible for vomiting, have not been overloaded, so she had the vomiting effect. Case 2 was a case of somebody who had used strong Ozempic, that so the milder rauwolfia vomiting effect was not seen. So whereas Zoe, who has not used sleeping pills, has not used anything for inducing vomiting, she's responding to the drug. And this happens even with our skincare. I say it all the time. You see, when your skin is used to hardcore lightening products, before you can respond to a herbal extract, it's difficult because herbs are usually less potent. They are milder, so they give a milder effect. Yeah, so it's a very interesting observation that I had with this herb. Please, if you have used sleeping pills to treat insomnia, it probably won't work.